Nigeria's Ministry of Health has reaffirmed its commitment to public health, driven by innovation, collaboration, and shared a vision of healthier Nigeria. In his keynote address at the National Conference of Sugar-Sweetened Beverages Tax, held in Abuja in partnership with Corporate Accountability and Public Participation Africa, the Minister of Health and Social Welfare, Mohammed Ali Pate, represented by Director of Food and Drug Services Department, Olubumi Aribena, said that the health burden of sugar-sweetened beverages consumption is particularly prevalent in low and middle-income countries, where rates of obesity and related health problems are on the increase. The cost of treating diabetes per person has surged from an average of 60,000 in 2011 to 800,000, and it is projected to exceed 1 million naira by 2030.
The goal of SSB tax is to reduce the consumption of these unhealthy beverages, ultimately preventing obesity and its related diseases. In 2021, Nigeria joined over 100 countries that have introduced taxes on sugar-sweetened beverages. This tax, embedded in the Finance Act of 2021, levies a 10 naira tax on each liter of all non-alcoholic sweetened and carbonated drinks. As we look to the future, we must view the SSB tax as a cornerstone of our strategy to improve public health and healthcare financing. By discouraging the consumption of sugar-laden beverages, we aim to reduce the prevalence of obesity and diabetes, and in turn alleviate the financial burden on our healthcare system.
The Executive Director of Corporate Accountability and Public Participation Africa, Akimbode Oluwafemi, said that public health in Nigeria is under siege as non-communicable diseases surge at alarming rates. Akimbode stated that the National Sugar-Sweetened Beverage Tax Coalition will continue to seek for a more effective tax on sugary beverages that will encourage reduction and increase funds for the health sector.
I think the consensus is getting clearer now that Nigeria needs a public health policy that recognizes sin tax as one of the key tools to reduce NCDs in Nigeria, as well as begin to get the necessary resources to finance healthcare in Nigeria. And specifically, this conference speaks to the sugar-sweetened beverages tax, for which the government had a 10 naira per liter imposed in 2021. Now we all realize that this is grossly inefficient and insufficient, so there is the need for that to be increased to be able to save public health in our country, as a measure against rising obesity, fatalities related to non-communicable diseases in Nigeria. For that tax to be increased to about 130 naira per liter, or that the government adopts the global best practices, which is now recommending between 20 to 50% of the final retail price of SSB products.
Other stakeholders present lent their voices to the conversation.
We must strive to create an environment where healthy dietary choices are the norm, supported by appropriate policies and robust health systems. Healthy diets are crucial for promoting health, supporting active lifestyles, and preventing diseases, including both communicable and non-communicable ones.
Food justice, the right to eat what nature wants me to eat. The right to access healthy and nutritious food. And in this case, we're looking at access, affordability, quality, and culturally available and acceptable food products, reversing the trend of ultra-processed food products and GMOs, genetically modified GMOs, and basically, this is a critical objective. This is one of the critical objectives of taxes on sugar-sweetened beverages. is hoping to address.
We want to look forward to a tax that will present a sustainable revenue source that can be directed towards enhancing healthcare services by creating dedicated fund stream through this tax. We can invest in preventive health programs, funding, we can invest in preventive health programs, upgrade healthcare facilities, and ensure that public health campaigns don't just end around here, but that we take it down to the grassroots, as that will help to also make the people ready and understand that it is not another tax burden, but that it's actually a way to healthy and safer Nigeria.
To continue to advocate for healthy lifestyle, because it is actually considered the primary intervention in the health sector, because if you start with prevention before you talk about treatment. And it is with prevention that is very important that we'll achieve, especially when we look at the report that says that the age bracket that mostly consumes sugar sweetened beverages is between 17 and 19.
Non-communicable diseases have been increasing in the continent, and what we have identified is that sugar is the main risk factor for non-communicable diseases, because it can lead to increased BMI, which can result in overweight and obesity. So what I'm trying to say as well is that introducing the SSB tax has been shown to be effective in reducing overweight and obesity.
The theme of the conference is Health Tax as a Recipe for Improved Healthcare Financing. In Abuja, for True Vision TV, Ebere Anyebo.